Hello friends, I am Dr. Vibhor Borkar and welcome to my part 2 of video on celiac disease in children. Now, we have diagnosed with celiac disease. Let's see how to manage it. We have seen that this happens in a genetically predisposed person by eating wheat. So we cannot change our genetics, right? So what is in our hand is to control gluten intake. So any grain which contains the gluten means wheat, barley and rye, it should not be consumed at all. So there is no bargain here. It has to be a zero. So we cannot eat it in a small proportion or that. So it's an all or none phenomenon. Either you eat it or you do not eat it. So that's why your diagnosis has to be very perfect, and that's why serology along with biopsy is very important. Okay, so basically it's a treatment is diet based. So in the initial part of the treatment, we give all the supplement because there are a lot of deficiencies in the body, and we start the gluten restriction. Gradually the intestinal lining heals and the body recovers. After a few months, the supplements are stopped. You can see the changes in the child's body life. The diarrhea will stop, bloating will decrease, child will be more active, child will start showing weight gain, and on the long term the child will start showing height gain. If you see, do the blood test, is anemia, vitamin D deficiency, magnesium level, albumin, this all should fall within the normal range. So on the follow-up, when you are diagnosed celiac disease, done with gluten restriction and there is an improvement, here we complete the diagnosis of celiac disease. So most important part is, if I am stopping wheat or gluten, what kid should eat? That's why it's very challenging, because for many people across the globe, wheat is very integral part of our staple food. Also, whatever the food, we get it from the outside. So many families cannot imagine the day without a wheat content. So that's why it's very challenging and can be overwhelming. But you have to remember that even a small amount of wheat is like a slow poison. So we have to avoid this temptation of giving a small amount of wheat. So rest everything child can eat. So all types of other grains like jawar, bajra, ragi, everything child can have. Child can have all kinds of pulses, all vegetables, all milk products, child can take it. Doesn't mean that there are not much options. You have to be very careful about the hidden sources in the diet. There can be a contamination, or the one who is preparing the food doesn't know there are the wheat elements in that or gluten contents in that. You have to be very careful about not sharing the food or the utensils which is made for preparing the food. Even you have to be careful when you are getting your flour grinded from a common mill. It should not be used for grinding the wheat. It should be that strict. When you are taking any food from outside or packaged food, you have to read the label. You have to learn about reading the labels. Also teach your child to read the labels. Label should mention gluten-free diet. It means that the gluten contains is 20 parts per million. And this is the industrial recommendation. Unfortunately, in countries like India, we don't have a government regulation on that. So, Indian products may not mentioning gluten-free products, or it is not regularized. So, you have to be very careful that in that entire premises of that food product preparation, wheat is not used. So, just labeling gluten-free product doesn't make it gluten-free product. So be careful about the hidden sources. Now let's see what happens if I don't treat it. See, your intestine is very important part, and whatever we eat, that gets absorbed and our body grows. If your intestine is damaged, you cannot have a very good productive life ahead. The child will be malnourished. He may not gain his adequate height. Sometimes in adolescent children, the puberty may be delayed. They may land up in pathological fractures. Even a long-term, untreated or inadequately treated celiac disease has shown to have even small bowel cancers. This is not to frighten you, but these are the facts. So that's why in the previous narration I mentioned gluten is a slow poison if someone is having a celiac disease. So don't get disheartened. There are many families across the globe. Connect with them, be positive, and have a gluten-free diet if your child is having a celiac disease. If you find this information useful, please like my video, subscribe my channel and forward this video to a person or a family who is having a celiac disease. Thank you.